Please can you remind me, if you'll be so kind, staring out into space, asking God to hear my case, trying to think of all things past. How long will my memory last? The purple angel, purple angel, purple angel, you're next to me.
Well, hi, everyone, and welcome to Alzheimer Speaks Radio. This is Lori La Bey, the host of Alzheimer Speaks. And for those of you that are new to this show, my mom had dementia for 30 years, and that is exactly why I switched careers and trying to make a difference, trying to raise everyone's voice, connect us to all different types of services, products, and tools. And today we are going to be talking about a large clinical trial that you're not going to want to miss. But before I go there, I just want to give a shout out to, again, all of our listeners. You guys are so wonderful. Your likes, your clicks, and shares have really spread the voice of Alzheimer Speaks worldwide, and I can't thank you enough. I want to read just a short poem written by Norms McNamara that I just thought, this is why we're here today. Norms has been living with the disease for many years now, and he is a super advocate. He's the founder of the Purple Angel, but he wrote this poem, and I just thought it just hits home. It's called A Mere Image. As tears flow down my swollen face, so many things look out of place. Tired shoulders, heaving slowly, shattered images, feeling lowly. I went to shave. What did I see? A stranger looking back at me. I looked again at that face. He looked so old, not full of grace. He was tired, ragged, and very sad. I thought I was, but just a lad. The saggy cheeks, the tired eyes, startled look from the midnight cries. If I could see what I can see, he doesn't even look like me. Who is this guy, this tired old man? Please find a cure if you can. And that was written by Norms McNamara. And again, I think it was just kind of a perfect rollout to our discussion on a treatment. I also wanted to just highlight the World Health Organization has a global action plan, and they just published their new report today, and it's called From Plan to Impact 2, and this is their second year, and it highlights what they want to happen between 2017 and 2025, and their areas and calls of action are as follows. Dementia as a public health priority. They are really trying to get everybody globally on board with this. Dementia awareness and friendliness, dementia risk reduction, dementia diagnosis, treatment, and care support, support for the dementia carers, and then information systems for dementia, along with research and innovation. And we all know how badly that is needed. Alzheimer's Disease International is also doing a survey, and they really need your help on this. You can just go to my homepage, alzheimerspeaks.com, and you will see a banner there for the survey. They want to know what you think about dementia, and this is really going to push and drive what services are needed. So please take a peek at that, and don't forget about the Cruising Through Caregiving virtual book club that is coming up, and that'll be a weekly affair from May 15th through August 28th. And last, I'm just going to give a shout out to Dementia Action Alliance for their second North American conference, June 20th through the 22nd. So let's get on with our show today, because it's going to be a good one. As you know, there hasn't been a new treatment in over 15 years, and yet the number of people affected continues to just grow and grow. Nearly 6 million Americans are diagnosed with Alzheimer's disease, and the cases are expected to triple by 2050. And so today we're going to talk about a first in Alzheimer's disease research, where more than 40 academic and private clinics across the country are coming together, and they're looking to enroll hundreds of people with mild to moderate Alzheimer's disease in a clinical trial. And again, that's what we're going to talk a little bit more about. The trial itself is called T2 Protect AD. That's T as in Tom, the number 2, Protect AD. So let me introduce our guest today. First, I'm going to introduce Dr. Leger, and he is a board-certified neurologist who specializes in Alzheimer's disease and related disorders, and he is an associate clinical professor in the Neuroscience unit at the University of California in San Diego. Also earned his medical degree from McGill University, and he's a fellow at the Royal College of Physicians in Canada. So welcome. How are you?
I'm very well. Thank you for asking, Lori. It's a pleasure to be here.
Well, good. Thank you so much. I'm going to introduce Dr. Qureshi next. He is the Executive Director of Neurology at Biohaven Pharmaceuticals, and he is a board-certified neurologist and physician scientist and clinical assistant professor in the Departments of Neurology and Medicine at Albert Einstein College of Medicine. And Dr. Qureshi earned his medical degree from Einstein and was a Hunt Scholar and holds a Bachelor of Science degree also in biomedical engineering from Johns Hopkins University, where he was a Goldwater Scholar as well. So welcome, Dr. Qureshi. How are you doing?
Hi, Lori. It's a pleasure to be here. Thank you for having me here today.
Well, I'm excited about this trial, and before we start, I always like to ask our guests if they have been personally touched by dementia in their own family or circle of friends. So, Dr. Qureshi, if you wouldn't mind answering that first.
Sure. I think like most people, I certainly have been touched by Alzheimer's disease in a myriad of ways, very closely in my family. Both my grandmother and one of my uncles has Alzheimer's disease. So, I certainly know what folks out there are going through and the huge need that there is for new treatments for people living with Alzheimer's.
Wonderful. Thank you for sharing that. And Dr. Leger, how about you?
Yeah, I'll echo Dr. Qureshi's comments. Alzheimer's disease is something that becomes more and more prevalent as we get old, and if our families are old enough, there's almost always somebody who's affected, and my family is no exception. My grandfather and one of my aunts suffered from the disease, and it took a terrible toll on them.
Okay, thank you for sharing. I'm going to start out here by asking first Dr. Qureshi to explain what exactly is the T2 Protect AD clinical trials and how did that get started?
Great question. So, I think that we all know about the huge unmet need for people with Alzheimer's disease. And, as you mentioned earlier, the last medicine that was approved was many years ago. And so Biohaven is really a company that is focused on diseases of the nervous system, including Alzheimer's disease. And we are all people like me who are drug developers who have also been touched by neurologic disease. And so we took an approach which is a bit different from the approach that other folks have taken, and we are targeting a brain chemical called glutamate. And glutamate is, in fact, one of the most important brain chemical messengers. So it's how brain cells communicate with each other. And we believe that in Alzheimer's disease, there is a abnormality in the glutamate levels. And so the messages between the brain cells get mixed up. And that's why we feel that some of the symptoms of Alzheimer's disease occur. So the thinking and memory problems, which, sometimes come and go early in the course of the disease. And so, our approach is to target glutamate levels and to try to normalize them and therefore to treat the symptoms of Alzheimer's disease. And so that's the study in a nutshell. we're focused on treating the symptoms in people with mild to moderate Alzheimer's disease with this approach.
Can you share with our audience, because we may have some people listening that don't know what those symptoms are? Do you mind sharing a few of those with our audience?
Absolutely. I think some of the most common types of things that may occur are memory problems. So, oftentimes, people start out with what's called some mild symptoms, and they're not really sure. I lost my keys. Is that Alzheimer's or not? Usually that's not. I think when we think about Alzheimer's disease, it's memory impairment that actually impairs with your ability to do the normal things that you would do in life. And similarly, other types of cognitive problems or thinking problems related to things like attention. So those are some of the more sort of prevalent types of things that we think about with Alzheimer's. I don't know if maybe Dr. Legere wants to chime in as well.
Sure. Dr. Legere, do you want to add anything?
Alzheimer's disease is a bit of a moving target as well. The symptoms change as the disease evolves, and so the very first manifestations, the very first things that happen to somebody with Alzheimer's disease might be very simple, like increased anxiety or a sense that they're not able to do things that they used to do, and they may be even quite aware that something is happening. But as the disease progresses, Dr. Qureshi is right, there's difficulties with memory, difficulties managing personal affairs, and that can become very frustrating to both the patient who's suffering from the disorder and for people around them who are realizing that they're not supporting the things, they're not able to complete the things that they need to do day to day. And there can often be as well a sense the patient who suffers from these difficulties may become less and less aware that they're having the problems, and that increases the difficulties in trying to help them. So it gets a little complicated as these symptoms evolve.
That's very true. And like the symptom of anxiety, that can go 12 different ways when you're talking with a physician in terms of, is it a dementia related, or, is it a psychological issue that somebody is having? Is there a lot of stress? What's causing these things too? So there could be a lot of misdiagnoses because the symptoms are so fluid. Well, thank you. Thank you for adding that. Can you tell us, Dr. Legere, how many clinical trials are there going to be around the country, and what is the name of the treatment itself being studied?
This particular trial, the T2 Protect trial, is being run out of, I think, approximately 40 different sites, including one here at UCSD. But there are many across the country. I believe we're trying to enroll as much as 400 patients, and the drug, as Dr. Qureshi pointed out, is called troriluzole. It's a prodrug of another medication that we have a lot of experience with called riluzole that has been difficult to give and difficult to tolerate, and this particular remaking of the drug into a prodrug helps us get higher concentrations of the drug in the body, and helps the patients tolerate the drug much better.
Okay. When you say prodrug, is that what you mean? I've not heard that term before. Mm-hmm. So are you meaning that it'll just be more easily absorbed and work with the body better, or am I off on reading that?
No, that's exactly right. Prodrugs are actually a mechanism that's used by pharmacologists to change a drug that might be difficult to take normally into something that can be taken much more easily, something that's absorbed better, and something that may be less toxic. A good example of a prodrug is aspirin. Aspirin is a combination of two different chemicals, and when it gets into the body, it's metabolized into the active ingredient which works well, and because it's modified, it's not as bad for the stomach. Troriluzole is a modification of a drug that's been around for a little while, as I mentioned, called Riluzole. Riluzole was historically difficult to take. It had to be taken at least twice a day. It had to be taken on an empty stomach, and you couldn't eat before or after taking the medication because it wasn't absorbed properly. And it caused side effects related to its effects in the stomach. The modification that's been made allows the drug to be absorbed very quickly and very well, so that we can get really high concentrations in the blood, things that we couldn't do with Riluzole, the active ingredient, before. And it means also that the drug can be taken much more easily without worrying too much about when you eat and when you take the medication.
Okay, great. Dr. Qureshi, is there anything you'd like to add?
Yeah, regarding troriluzole, I think that the prodrug approach, as Dr. La Bey mentioned, is really one that is a trick that drug developers have up their sleeve to take something that exists that potentially has problems and really to improve on it. And I think that that's somewhat of a unique strategy these days, where we start for Alzheimer's disease by searching for the new medicines. And this approach is really taking something like targeting glutamate, which we know is potentially a validated mechanism, something that we know works in diseases like Alzheimer's disease, and trying to make it better. And so I think that this is really, I think an exciting time, and the medication, the active ingredient in animal studies seems to have very, sort of potential benefits on thinking in animal models of Alzheimer's disease, and in animal models of aging. And so we believe that the symptoms can potentially be improved based off of that animal work. But also, very interestingly, the animal studies suggest that the medication can reduce the progression of Alzheimer's disease. So, it's kind of a 1-2 punch in terms of improving the symptoms and then maybe preventing the disease from progressing. And this study, the T2 Protect study, is really focused on the symptoms, but there may be additional benefits based on some of that laboratory animal work in Alzheimer's disease models.
Okay, great. I was also curious, we've heard so much about amyloid plaques, and how does this different? How is your study different? Can you explain the difference to myself and our audience in terms of what you're doing versus the amyloid plaque studies that have been going on?
Yeah, so that's a really great question, and one where, the simple answer is this medicine does not target the amyloid. And, there's been decades of research into the cause of Alzheimer's disease. And, we thought we had figured out that amyloid was really one of the main culprits. And so it really made sense that reducing the amyloid would be an important treatment. And it still may be, although that's not what the studies have shown us so far. It may be that we're trying to target the amyloid too late in the course of the disease, and maybe we have to start much earlier. But, there are some unknowns. We don't know exactly what the role of amyloid is in the disease. On the other hand, with glutamate, one of the hallmarks of Alzheimer's disease is the loss or the death of those glutamate connections that connect the different nerve cells. And so by targeting glutamate, we think that we're really targeting something that is a hallmark of the disease.
Well, that's exciting to be able to pinpoint that. That's wonderful. I'm going to pull in Dr. Legere here again. Anything you wanted to add to what Dr. Qureshi just talked about?
Sure. we know that that amyloid accumulates in the brains of patients who suffer from Alzheimer's disease, and as Dr. Qureshi pointed out, that the link between the accumulation of amyloid and the symptoms that people suffer from is not clear at all. We think that the amyloid might be responsible for some of the very, very earliest changes that occur in the brain. That later lead to the changes to the cells, and in particular the difficulties with neurotransmitters or the chemicals such as glutamate. So when the sense that we could get rid of amyloid or change amyloid in order to help our patients once they have symptoms has not really been proven. There's been a lot of trials that have taken place that have successfully removed amyloid, but the patients didn't benefit from that from a clinical point of view. Their memory didn't get better. So we've been rethinking that a lot, and we've been deciding to try to treat patients before they get symptoms. That's a little harder because we can't really find people with Alzheimer's disease before they get symptoms, and that becomes a whole a large issue in itself. How do we find patients that have amyloid but don't have the symptoms of Alzheimer's disease yet? But for those patients who do, and there are 6 million in the U.S. alone, how can we treat those patients? And I think that's why a medication like troriluzole that impacts those parts of the brain that are not working well at that particular point in time. That's why that's so important, because that's where the symptoms are coming from malfunction of this part of these particular cells, and helping those cells function better and helping them withstand any further damage is the hope with this medication.
Can you explain to us also who can actually participate? I know that there's always guidelines, and that's one thing I always hear from people is like, oh, we jumped through this hoop and we jumped through that hoop, only to find that, we weren't a fit. And that's just part of any trial. You have to have guidelines so that you've got measurable results that you're looking at. So can you tell us who can participate in a study? What are you looking for exactly?
Well, we're looking for people who have been diagnosed with Alzheimer's disease and who are considered within the early or moderate stages of the disease. And in particular, this is when the glutamate system starts to malfunction the most. We're recruiting people who are between the ages of 50 and 85, men and women, and most people who have Alzheimer's disease who are in this stage of the disease, the early and the moderate stages, have been started on medications, medications like donepezil or galantamine or rivastigmine. These medications are allowed in the study. They don't prevent anybody from entering the study. And another requirement for participation in the study is having a partner, somebody who can come to the visits with the patient.
Okay. Now, you had mentioned, early to moderate state, and I love that your numbers are down to 50, because that was one big complaint. People were saying, we're too young for some of these studies. So that's great to see. Now, a person with MCI wouldn't have a diagnosis of Alzheimer's disease yet, and so they would not be applicable for the clinical trial, correct?
That's correct. Yeah. So
okay.
Yeah.
Okay, because a lot of times they feel that they still fit that. Personally, they still feel that they should fit in there, but they don't. Dr. Qureshi, anything that you would like to add in terms of participants and who you're looking for?
Yeah, absolutely. I think Dr. La Bey mentioned some of the criteria that we have. They're also on our website, and that's something that folks can access. Should I give the website address?
Sure, you can go ahead and give that out, and we'll give it out again at the end, but that's fine.
Okay, perfect. So that's www.t2, that's the number 2, protect.org. And if you go to that website, you can see some of the criteria as well as the centers that are participating in the study. And, regarding the other question you were just talking about in terms of the eligibility for people who maybe don't have a diagnosis of Alzheimer's disease, but might have earlier, memory and thinking questions or concerns, something called MCI. I'd just like to point out that, there are a lot of studies out there for people who are in very early stages of Alzheimer's disease, but there aren't so many trials out there today for people who are suffering from the symptoms, the mild to moderate Alzheimer's disease folks. And so this is something that I think is really important. This is when folks come and see Dr. Leger and they complain about the problems that they're having in their day-to-day lives. It's not the people who, come in and say, well, I'm worried I might get Alzheimer's in 5 years. Those aren't the folks that we're targeting.
And like you said, there are an awful lot of those people that are trying to sort things out. And so it's great that your study is so large and throughout the country, which is sweet. One of the questions that I know people are probably wondering is, do they have to go to a physical clinic, or can they, do a lot of the intake over the phone or by a video conference? How does that work for enrollment of the study? Dr. Qureshi, if you wouldn't mind.
Sure. So the simplest way is really to call one of the participating centers and to speak with them about their procedures. Many of them can talk to people over the phone and begin what we call pre-screening, just to see whether or not it makes sense for them to come in person and talk in more detail about the study.
Okay, wonderful. And Dr. Leger, anything that you want to add to that at all?
Yeah, I see patients every day in clinic and for clinical reasons. I follow patients with Alzheimer's disease and patients with MCI, and a lot of my patients, they want to participate in clinical trials. They're very, very interested in it, and as Dr. Qureshi pointed out, for patients with early and moderate Alzheimer's disease, there's actually been a dearth of clinical studies. We really haven't had much to offer them. So the arrival of this particular study has been really, really exciting for people like myself who haven't had very much to offer our patients with mild to moderate disease. Participating in the study is exciting. Most patients actually enjoy coming to the center to visit with the people who are running the study, with the trial coordinators, with the physician who's in charge of the study.
Dr. Leger, are you there? I'm going to pull in Dr. Qureshi. Are you there?
Yes, I'm here.
Okay, we must have lost him somehow. He's still showing up in the studio, but if you wouldn't mind taking over the conversation in terms of the path he was going down, that would be really helpful.
Sure. I mean, I think I would just reiterate, the comment about the excitement and the enthusiasm that we are hearing from the many physicians that we're partnered with at the trial sites. And the words that we're hearing from their patients, which is that, there's a huge need, and this trial is really something that people are excited about participating in. And we're very pleased to have the opportunity to partner with so many great sites around the country. We're running this study in partnership with the Alzheimer's Disease Cooperative Study, also called ADCS. As you may know, and many folks may know, they're the premier Alzheimer's disease clinical research network. They have many sites around the country that they do trials with, and so we're very excited to have the leadership of the ADCS as our partners.
Oh, that's fantastic. Now, one question I know that people have is it going to cost me anything to be in a trial? Or some people have said, well, we've got a little stipend or gas has been paid or something like that. Are there any costs to be in the trial itself?
So, generally for research purposes, this is different from clinical care. There are no costs that are associated with participating in the research study. We try to make it equal, for everyone who wants to participate, and that's really important.
Is there any compensation for travel or anything like that? Or I know you've got clinics all around the country trying to make that a little bit easier for people to access. So, but I thought I'd throw that out there because that is a common question people do ask.
I think that's something where the folks generally work with the site, and each clinic may do things a little bit differently. For example, as you mentioned, some people may need some support for travel and parking and things like that. And usually those things are taken care of at the level of the individual clinic and the site because, it's so important to make sure that the folks who want to participate can, and that these kinds of barriers are not really things that prevent people from participating in important research studies.
Okay, great. And I'm just going to check and see if Dr. Leger is back with us or not.
I think so. Hello?
Oh, you are? Oh, okay,
yep. Great,
you are. I had you off mute, and I wasn't hearing any rustling, so then I thought we had lost you there. So, so thank you. Was there anything else, Dr. Leger, that you wanted to add as far as participants' involvement? We had talked that, there really isn't any cost to them to be included in the study, and there might be some minor compensation for parking or transportation depending on the clinic itself and what's established there.
Yeah, I mean, I can speak as the PI for our particular site, and I think most sites probably have a similar approach. We try to facilitate involvement of our patients in clinical trials like this one. So typically parking is free, and we do everything we can to accommodate the times that work for the subjects. And there's also a monetary compensation for participation in this study, which may vary from site to site. It's not a lot of money, but it helps.
Okay, great. Now, in the screening process itself, is it verbal, or do they have to go through some medical tests in order to be evaluated for this study, Dr. Leger?
Yeah, I think all studies of this kind require that we make sure that the person is healthy and can be part of a clinical study that involves an investigational drug. And the study itself is looking at, so there'll be blood tests to look at liver function and kidney function, things like that would normally be done in normal clinical practice anyway. We look at heart function with an EKG, an electrocardiogram. So these are very routine things. Because this is a study that involves Alzheimer's disease, we will also be testing for signs and symptoms of Alzheimer's disease. So we'll be looking at memory and ability to speak, ability to understand. So there's paper and pen tests that are performed at many of the visits through the study. And finally, we're also very interested in seeing the health of the brain itself. So there'll be imaging tests, like an MRI, where we make we acquire very sophisticated scans that allow us to look at the brain structures to see if the medication is helping from that point of view as well.
So this might sound like a strange question, but that's kind of how my brain works. So, Dr. Leger, when people go through these trials, do you guys ever encourage or just give them the information about having their brain autopsy at death? Is that something that would be helpful in the process? I just think a lot of times people don't know that that's an option. That is available to kind of help push for a cure ahead of time, and it just seems like a real easy time to be able to give that information to somebody. and maybe it would help. I don't know in the trials in the future. What's the process? Is that even something that you can do, or does that cross a line someplace? And do you think that would be of value?
I'll just say that within the context of a clinical trial like this one, autopsy or brain donation isn't something that usually comes up. But as a clinician who sees patients with Alzheimer's disease, and as a member of a community within sort of an academic center like ours that's part of a Alzheimer's disease research center, we're extremely interested in understanding how the disease evolved and what ultimately happened to that person's brain. So we strongly encourage brain donation as part of full care, if you will. So it's not something that's compulsory. It's not something that we bring out when we first meet people. But I think a lot of people, when they're part of this sort of research setting, whether it be in a clinical trial or within an Alzheimer's disease research center, they want to know. They want to be able to say, oh, this is what was going on, and it was confirmed after our loved one passed by analysis of the brain tissues.
Yeah.
It is taking the science further and further every time we were able to do that.
Wonderful. Dr. Qureshi, any thoughts on the autopsy question or giving people information regarding that during a study?
It's a really good question. So I agree with Dr. Legere that it's really important, I think, for people to discuss this with their clinicians and neurologists, because I think as neurologists who take care of people with Alzheimer's disease is really different than, say, our colleagues who are cancer doctors who take care of people with cancer, where they're able to look at the tissue and look at the biopsies and really know what's going on with the person and their disease. And we've seen some of the tremendous advancements in cancer research over the past few decades. And I think that, as neuroscientists, we're very jealous of our colleagues because there's no substitute for actually being able to look at the tissue, and that really helps to advance the science. Within the context of a study, there's not really a role for something like autopsy and brain donation. It's really sort of a separate, what we call natural history type of approach to really understand the disease and how it progresses over time in the absence of a drug treatment.
Yeah, I'm always looking for ways just to be able to educate people of what's available and what they might want to look into. And that's why when you have someone's captive attention like that, to me, it would, as a non-medical person, it would just make sense to be able to mention that or have a flyer or something while they're in that mode of trying to help push things forward. Because, again, I think there are so many people that don't even know that exists to begin with. And, and it's just what I hear when I talk to people around the world that, once they're involved, they want to stay involved. And sometimes that can get missed. I know we did that with my mother, and it was, it was pretty amazing, the results of what they found after her living with the disease for 30 years. And stuff. So not just, and it was something she really wanted to do herself. And sometimes it just takes time for people and for families to get over what does that mean, to the person and to their beliefs in terms of death and dying as a whole. You're catching them early on to kind of process some of that stuff. Dr. Qureshi, let's move on and talk about how long does this study take, and what is there one set that's going to get a new drug and another one that is not going to get a placebo, or what actually happens, and will people know if they're getting real treatment or not?
Great question, and these are the types of questions that Dr. Legere probably has answered a lot of times for the folks who come in and talk to him about the study. the study duration is for 48 weeks, and we designed the study to really be able to see whether people are improving compared to placebo-treated patients. And so that means that there is a randomization. There's basically a 50-50 chance that you will get the study drug or that you may get a placebo. And that's really what's required to, really do a rigorous test of whether the medication is working. And so that's how this study is designed. But we also hope that, sort of over this period, we'll be able to evaluate, the potential, change between the placebo-treated folks, the sugar pill-treated folks, and those that are treated with the medication. And if successful, then we'll be able to, go forward and try to offer this to, thousands, if not millions of people who have the disease. So I think that this is a part of the rigorous scientific process to prove that the drug actually does what we hope it does.
Wonderful. Dr. Legere, anything that you want to add to that?
No. I second Dr. Qureshi's comments that it's a short study, 1 year study, 48 weeks, and the study is geared to demonstrate, hopefully, that the medication improves people's overall function and potentially reduces the progression of the disease. So we're measuring that with both clinical tests of memory function and with MRIs to show that potentially the parts of the brain that are involved are healthier or remain healthier than the ones that are not getting the medication.
Great. Is there a limit to the number each clinic can handle, or an overall number that you want in this study, Dr. Legere?
I think Dr. Qureshi can probably answer the statistical question a little bit better, but the calculations have been made in the hope that we can get maybe a 40% improvement in function, and to the number of people that would be necessary in order to do that is between 300 and 400. So there's about 40 sites over the country. That means about 10 patients per site.
Dr. Qureshi, anything you'd like to add there?
No, Dr. Legere said it. The goal really is to, make this study available to people who are interested in participating. That's why we have the study centers around the country. There really aren't limits, I would say, on each center. We call it competitive enrollment, which basically means that, if a site has lots of interested patients, there's no cap for them. And what we tend to see in these kinds of studies is that certain centers have a lot of patients and others have less. So in the end, it sort of balances out.
Okay. Is there anything that we haven't covered other than contact information, Dr. Qureshi, that you'd like to add?
No, I just want to thank you for having us and giving us the opportunity to talk about this important study. I think it's such an exciting time for people with, who study brain diseases. I think, as I said before, I've been touched personally. That's why I do what I do, and we have many years of advancements in the science, sort of behind us, and we hope that it's a bright future with treatments for many of these disorders that don't have treatments and cures today.
Well, thank you. Dr. Legere, anything you'd like to add?
No, I'll echo Dr. Qureshi's comments that we're excited about bringing new medications to patients, and this certainly is a new and exciting medication, in part based on the data that's been accumulated up to now in preclinical studies. And I'm also excited about this medication because it does target patients who have not had an opportunity to participate in clinical trials because of their diagnosis and the state of their illness, it being moderate. So it's an important step, and I'm really excited that it's happening right now.
Okay, that reminds me actually, and I'll throw this one to Dr. Qureshi. Once you get the data, after the 48 months, how long does it take you to review that, or is the review going on during this time frame to figure out what the end results are and what your next steps are? How does that work?
Great question. So, every study is designed a little bit differently, and the way that we've designed this study is really, I think, a very innovative design where we are going to do what's called an interim analysis, which is to look at some of the data, when we go about halfway through the study. And so we will plan to look at that data in the interim analysis in a very sort of specific way to make sure it's worth continuing doing the study, and to make sure that we're being very efficient. And at the end of the study, at the end of the 48 weeks, then we'll look at the entire data and be able to answer the question about, is there a benefit that we can measure? That sort of just takes its own time to, for us to get there. So I can't really comment about that, but I would say is that, I think everybody knows that this is such an important area, and we're moving as quickly as we can, and while also trying to be efficient and things like that. So, we can hopefully change and have a new treatment available for people.
Okay. Now, another question I just thought that I didn't ask you is what phase is this? Because I know that there's phases to clinical trials. And so what phase are you in right now?
So this is a study which is designed as a phase 3 type study. And what that basically means is that if the study is positive, that hopefully, that is something that would support going to the FDA and talking to them about whether the drug could be approved. And, most studies are either divided into kind of early stage or late stage. So this is a late stage study, and so that's one of the reasons we're so excited about it.
Okay, wonderful. Well, thank you both so much for taking time to be with us today. It was interesting to learn about. And again, for our listeners, you can call a toll-free number if you'd like, and that number is 833-3T as in Tom 2 study STUDY, or you can go to their website, which is www.T as in Tom, the number 2, and then protect PROTECT.org. And we would love to have you back once you have your results to talk about what happened, if you're open to that. Again, thank you both so much for your time. It was wonderful to talk with you, Dr. Qureshi and Dr. Legere. Thank you so much for the work you're doing. And I know, this is the only way we're going to make a difference is keep trying out there, keep hitting that ball into the ballpark. And if we can help raise your voice in what you're doing, we would be more than glad to do that anytime. So thank you. With that, I am going to just give a shout out to a couple other organizations. The MemoryCafeDirectory.com is a wonderful resource if you're looking for support and being around some peers who are walking the same journey as you. Calendar Cards, both Calendar and Card starts with a K, is a memory system created to help those diagnosed continue to kind of manage their own lives, and they are the creator of the MemoryCafeDirectory.com, and it's very easy to use. You can find one in your state. They're actually starting to build them now for other countries. And if you have a Memory Cafe and want to be listed, there's no charge. They will gladly do that for you. Just go to MemoryCafeDirectory.com. I also want to give a shout out to Purple Table Reservations. They still need more restaurants to participate. They have people really interested in being able to going to a restaurant that is trained to deal with dementia, who has simplified menus, who understands lighting and sound needs as well as menu needs. And you can go to purpletables.com, and they have a handy little app. You can see what restaurants are in your area, or maybe approach somebody in your area to partake in that. Also want to give a shout out to the Aid List. They're just a wonderful group who is always gathering research data that you can do by answering questions over the internet. And you can find them by just going to usagainst-alzheimer's.org/networks/A-list. Or you can go to my homepage. I believe I've got a banner for them out there as well. And then the Alzheimer's Research and Prevention Foundation, they do deal with holistic modes, so exercise, diet, meditation, all of those types of things. And again, thank you to our listeners. You guys are just absolutely wonderful. Please share this episode with people. This is, we want to get people in these clinical trials. We want to push research forward, and with your help, we can do that much faster. So thanks, everybody. Have a blessed week. Talk soon. Bye-bye.
Hi, this is Suzanne Newman, host of the Answers for Elders podcast and radio show. We are the North Star that guides you through the complicated journey of senior care with trusted experts in money, law, living solutions, and more. So join us on this station, your favorite podcast channel, or just go to answersforelders.com. Meet the way showers who will help your journey go a lot easier.